I am Editorial Fellow in the Journal of Immunotherapy and Precision Oncology. And I'm also a pediatric oncologist and hematologist from Syria. I have the honor to welcome Dr. Megid. Welcome, Doctor. Would you please introduce yourself?
Yes, thank you so much for inviting me to discuss our review. My name is Thais Megid. I'm a medical oncologist working at George Dumont Hospital in Canada. I'm also an assistant professor associated with Sherbrooke University in Quebec, Canada. And I'm so happy to be here today to share a bit of the review we wrote. I just want to start by saying that the tumor microenvironment is so much more than just the cancer cells themselves. It's the whole ecosystem surrounding the tumor, including immune cells, blood vessels, fibroblasts, and extracellular matrix. All of these components play a crucial role, not just in how the tumor grows and spread, but also in how it responds to treatment. We realize that if we want to better understand how the tumors behave and why some treatments work while others don't, we really need to dig into the tumor microenvironment. That's what motivated us to write this review. We wanted to explore the latest research on the different components of the tumor microenvironment, and at the same time discuss the challenges of targeting the tumor microenvironment.
Mm-hmm. Mm-hmm. Very interesting. It's a kind of another aspect, or with many things which is new, and there are a lot of potential to make a kind of development in managing cancer, treating cancer, and understanding cancer, of course. Thank you. So what are the key findings in this issue, in this article?
Well, great question. We concentrated the review in three main topics. First one, targeting the tumor microenvironment components itself. The second, challenges in targeting the tumor microenvironment. And third, emergency technologies in tumor microenvironment research. And I'll give you a few examples. One of the example of targeting tumor microenvironment components is through cancer vaccines. A good example is a drug called Sipuleucel T, FDA-approved dendritic cell vaccine for metastatic castration-resistant prostate cancer, which has been shown to improve overall survival. This is just an example of a drug that targets the dendritic cell component of the tumor microenvironment. We also explored strategies of targeting T cells beyond PD-L1 and CTLA-4 inhibitors. That includes CAR T cells, regulatory T cells by specific antibodies. And we also discussed potential strategies in how to convert cold tumors into hot tumors by using cancer vaccines, oncolytic viruses, and radiation therapy. Then the second area that we explored is the challenges in targeting the tumor microenvironment. An example, when targeting blood vessel component, for example, we discussed how resistance to VEGF inhibitors often arise due to immune suppressive factors within the tumor microenvironment. This highlights the potential of combining anti-vessel targeting therapies with immunotherapy to overcome the resistance. And finally, in the end of our review, we examined new technologies in tumor microenvironment research, including artificial intelligence that is being used to analyze the stroma and mapping cell-to-cell interactions. So it helps us to understand the tumor microenvironment, and also nanotechnology, particularly the development of nanoparticles that seems to enhance treatment efficacy, minimize side effects, and improve bioavailability. So we also discuss about these new technologies when it comes to tumor microenvironment research.
Yeah, very, very interesting issues that you approach there. Last figure, which is figure number 3, it was very attracting one. Would you please talk a little bit about it to us?
Yes, I will try to summarize the figure 3 in words. Basically in the figure 3, we talk about mechanism of actions of therapies in the tumor microenvironment, and then we list 6 main therapeutic strategies to disrupt these interactions and enhance immune-mediated tumor attack. So I will list the 6 strategies, and then I will give some examples. So starting by the first one, dendritic cell activating. Second one, cytotoxic lymphocyte enhancement. Number 3, Treg suppression. Number 4, cancer-associated fibroblast inhibition. Number 5, angiogenesis inhibition. And number 6, macrophage reprogramming. Okay. So when we talk about dendritic cell activation, strategies we can use is we can boost antigen presentation using GMN, CSF, CD40, FLT3 agonist, and the dendritic cell vaccines. When it comes to cytotoxic lymphocyte enhancement, we can use CAR T cell as a strategy. And other therapeutics targeting T cell. Number 3, Treg suppression. We can use drugs such as TKI, sunitinib, checkpoint inhibitors, or even chemotherapy such as cyclophosphamide to inhibit immune suppressive Tregs. Cancer-associated fibroblast inhibition. We can use target CAFs with mesothelin antibodies in experimental models that we list in our review. When it comes to angiogenesis inhibition, we can use VEGF, that is a very known drugs that we've been using to target the vessels, and other TKIs, and including mTORs inhibitors. And in terms of macrophage reprogramming, there's different things we can use, such as CD40 agonist and CSF1R inhibition.
What is or what will you want from us to take as a home message?
Well, I think the main takeaway is that tumor growth and metastasis are driven by a dynamic change in the tumor microenvironment. So in order to develop more effective treatments, we must address the barriers within the tumor microenvironment. And to overcome this challenge, we need more clinical trials specifically designed to target the tumor microenvironment that take into consideration its complexity and heterogeneity. So we hope to incorporate artificial intelligence and nanotechnology as a tool to better understand it and improve treatment efficacy. So if we understand the tumor microenvironment is dynamic, and it's impossible to target a single component itself. It's very dynamic. I think if we understand that in the end of the review, that's I think that's the most important thing. Yes.
Thank you.
Thank you so much.
Thank you very much for giving us this time or taking the time to explain and be with us in the JIPO channel. Thank you.
Thank you.